Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 8, Episode 2 of the Function with Purpose podcast. Dr. Amy here. Hope everyone is having a lovely morning, afternoon, evening, early morning. Just make sure you have that coffee in hand. Thanks for joining in. Okay, Episode 2, getting right to it. I really like this topic, actually. And I recently, or not too long ago, have done a coffee talk kind of on this topic as well. So I will reference that in the comment section so you guys can take a peek at that. That does have my face associated to it. So today's topic, when the medical system doesn't work. So this happens too often and too commonly in the culture of the USA. So much that, unfortunately, when someone enters the medical system, especially, now, again, I want to be clear on this, when someone is experiencing a musculoskeletal issue. Some examples of that may be lower back pain. Maybe it is an ankle sprain, or maybe it is headaches. So headaches that actually stem from the upper neck, which will lead into my story today. Unfortunately, when patients kind of seek medical attention first, that it can, and it quite commonly starts a snowball effect where literally patients become or get passed on from physician to physician without gaining access or answers to what they have come in to seek help for, right? So unfortunately, this is still a thing. There's definitely a common rise and a significant rise and increase in prescription medication usage, as well as a loss of health, wellness, fitness, and recovery processes or controllables that the patient just is unable to foresee and control again. So when the medical system doesn't work, I think, from my opinion, is if it's not a medical issue, like, oh my gosh, I'm getting heart palpitations and I'm getting left arm numbness, tingling, that is an indication for a possible stroke or heart attack, especially heart attack that may be stemming. That is a medical system concern. I am talking about, hey, I hurt my shoulder doing a handstand push-up, or I was doing a cartwheel, and my shoulder's bugging me. I can't sleep on it, right? Two different things. So a musculoskeletal concern that interferes with exercise, daily movement, and fitness versus heart palpitations, heart pain, chest pain, getting into my left arm. That is a medical emergency, right? I want to make sure that stuff like that is experienced is clear. So this is going to lead into my story that I want to share with you guys regarding a patient of mine who I am so thankful she was referred to me by my circle of influence of trust. Sarah Sumner, I'm going to call you out. Thank you, sister. I appreciate it. She is a local licensed bodywork and massage therapist here in Charlotte. She's awesome. So Sarah actually referred a patient slash friend to me because this particular patient was experiencing headaches, or what she described on her first visit with me, zaps. So on her first visit, we really dug into the subjective, like, when did this start? How did this happen? How long has this been going on? What's your social life like? What is your daily routine? What do you do for work? Do you exercise? And first thing off the bat is she's like, well, I have a neurologist appointment scheduled for a follow-up. They put me on tramadol and gabapentin. That stuff isn't working. And now I'm on meloxicam and some other opioid or something. And I don't even want to take that stuff. And actually, I'm also referred to a spine specialist, a spinal surgeon, because no one knows what's going on with me. So right then and there, from my perspective, I'm like, oh man, the medical system is not working right now, and the medical system is not appropriate at this moment. This is what I'm thinking. So, anywho, we really dug into our subjective, and at the end of our evaluation, I said, hey, these are some things that we need to control, because none of this was even stated by you. Water intake. Can we promote hitting in ounces half of your body weight in water? Water intake. So about 60 to 80 ounces of water a day. Sleep pattern. She already told me right off the bat that her sleep was poo-poo. Like getting 1 hour of sleep a night. So, okay, how can we make this better manageable for you? Maybe go to bed, physically go into the bed 20 minutes before you want to go to sleep. Keep in a dark room. Okay, maybe those two things to begin with. And room temperature, right? Getting it down to like 65 degrees. And one other thing is getting some type of daily movement. I want you to go outside in the sun, walk your dog 3 times a day for 10 minutes. So you accumulate 30 minutes of daily movement. Because unfortunately, this patient has been doing nothing and has been keeping herself inside the house, which she works from home to begin with. And I said, speaking of, I know, she's like, well, I don't like to go outside much. And I'm like, well, how about this? How's your workstation at the house? Do you have a window that you can set your desk up near so that when the sun comes into the window, like it's hitting you? She's like, oh yeah, I could probably do that. So that was kind of our first visit. Now getting into the next consecutive visits. Okay, are you journaling? How much water have you did? Digging back into those controllables that we set up at our first visit. She said, well, I wasn't the best, but here's what I got. She actually journaled. She also noted, we did some testing. She did a strength lifting session after her first visit, and she got those zaps really bad, like the next day into that night. So then we said, okay, let's try more aerobic base, where it might be a faster pace walk for 2 minutes and a slower pace walk for 1 minute, for a total of 10 minutes. So we try an aerobic base, because maybe strength based, where we're holding our breath and it's more intense output, might be too much for her nervous system right now. So those are some things that we kind of talked about into her next physio session and treatment. Trying to instill and incorporate controlling the controllables. So at that second session, actually, I introduced her and we talked about the Fwp band. No, I'm not sponsored by them. She's like, oh yeah, I'm on it. So she, going into our third session, so our second treatment, she has the Fwp band. I'm like, okay, so we're explaining some of this. I'm explaining this to her. I'm like, okay, it's going to take a little while for metrics and data to be collected. Luckily, this patient loves data. So she and I are a nerd at heart, but understanding and recognizing if there's any patterns that's developing. How much sleep. The Fwp band tracks the sleep. It tracks our stress levels. It tracks activity, right? You can track walking. You can track stretching, etc. So finding and helping this patient navigate a pathway that she can regain control again. And honestly, when it comes down to it, interacting with this patient, it has been awesome so far. So we're making slow gains here. But from the physical therapy perspective, we have to ask the right questions. Because from the medical system standpoint, there are barely any correct or right questions that they ask the patient that's in front of them. Because they literally only have, on average, 5 to 7 minutes with each patient. Now, from physical therapy perspective, we have like an hour, hour and a half. We can have as long as we want. And guess what? With this particular patient, and with pretty much all of my patients, I text message them. And this patient, she has a Fwp band. Well, guess what? Fortress Physical Therapy has a Fwp team, and she joined that team. I introduced that to her so I can see how much sleep she's getting. Has she recovered in the red, in the yellow, or in the green percentage range? So if you are familiar with Fwp, you know what I'm talking about. And how she's overall feeling, right? So we are collecting a lot of data, which then in turn gives her the baton back to controlling her life again. So we talked about, to kind of end this podcast, because this could be a very long one, that as I continue to work with this patient, we are slowly adding one thing each visit, or replacing one thing with another each visit, physical therapy treatment session, with a thing that's a little bit more effective or a little bit more controllable for her. And we're slowly getting back into some aerobic-based typed regimen. So, no, and side note, not to mention, getting off of long-term depression medicine, which has been a goal of hers. So, as I speak right now, I follow up with her tomorrow. So we will see where she is in that process, in that tapering of the depression medicine. Yeah. So when the medical system doesn't work, in my professional opinion, 9 times out of 10, or at least 80% out of 100%, patients seek medical attention first because they are unaware that this most likely is not a medical concern, like a medical emergency concern, right? Heart attack, stroke, cancer, a severe broken acute bone, right? I'm talking something that no one has tried to control the controllables again, or the 4 to 5 pillars of health and wellness, fitness, and recovery. Sleep, movement, nutrition or water intake, right? Stress management. So that is where I'm helping this patient in particular, for this example, to get back to control her life again, which then in turn, I think will decrease this headache sensation that she's gravitating, or that she is experiencing. And we do some other treatments within the physical therapy session besides a lot of education. That's for another day. But when the medical system does not work, entering it too early, which then creates a snowball effect of patients being tossed from physician to physician without full answers to their concerns, without answers to what is the underlying cause of this patient's zaps or headaches. You don't need to take prescription off the bat. Quit shooting in the dark. Find someone who can help you regain control first, and then be able to recognize when it is better or best to enter into the medical system. So if you're in the Charlotte, North Carolina area, or if this sounds like you, reach out to a physical therapist. Reach out to Fortress Physical Therapy. It is very important to find a healthcare provider who is able to dig a little bit deeper and recognize when the medical system is not appropriate right now, or when That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.